Children, teens and young adults. How vulnerable are they to COVID-19? Statistics are starting to show they might not be as safe as originally thought.
The reason I believe that we're seeing more of it occurring right now is just because of the sheer number of children who have been exposed.
Doctors are still working to understand the risks, and government officials in many cities warn against complacency.
It's no time to get cocky, no time to get arrogant. This virus has deceived us every step of the way. We have been behind this virus from the very beginning, and it still surprises us.
The more we live with coronavirus, the more we learn about who it affects and how. The reality is more complicated than we ever realised. I'm Rob Watts in Berlin. It's good to have you with us. Doctors around the world are working to understand an illness with possible links to the coronavirus found in children. It shares symptoms with the rare, potentially life-threatening blood condition Kawasaki disease, which can cause toxic shock. Cases were first reported in the UK, Italy and Spain. And now the United States is seeing clusters of the disorder.
A warm welcome for 8-year-old Jaden Hardawar. He's back home from the hospital after coming down with a rare pediatric inflammatory condition, one that doctors say is somehow linked to COVID-19. There are now more than 130 cases recorded in the U.S. 3 children have died. Officials say this highlights a greater risk for children during the pandemic than originally thought.
Now we see something different that we did not see in the beginning, and the entire medical community is coming together to answer this challenge, and we take it very, very seriously. And I want everyone to take it seriously. I'm going to keep saying to parents and family members, I need you to be vigilant to protect your children, all our children, because your vigilance will make all the difference in this crisis.
Symptoms are similar to those of Kawasaki disease. They include fever, a widespread rash, so-called strawberry tongue, where the tongue becomes bright red and swollen, bloodshot eyes, and swollen lymph nodes. Concern is also growing in Europe, as children head back to school after weeks of lockdown. Now parents are asking if it's really safe.
The news from the last 10 days is that this disease is similar to Kawasaki for young children. We still have a lot of questions.
For now, health authorities around the world have few answers, but are gathering the data they can.
What we've asked for is for the global network of clinicians to be on alert for this and to ensure that they capture information on children systematically.
The statistics still paint a positive picture for children, showing they are unlikely to become infected with COVID-19. And doctors stress the link to the Kawasaki-like symptoms still isn't 100% certain.
Well, let's speak to Dr Lawrence Kleinman. He's an expert in children's health at Rutgers University in New Jersey. Dr Kleinman, is the idea that children are barely affected by coronavirus an out-of-date idea?
I think it is, Rob. Good morning. Truly, we are learning more about this virus and how it affects adults and more so children every day. We originally thought that this disease seemed to spare children. We now know both that they can get the infection without symptoms and they can become very seriously ill from the disease.
Well, there's been a lot of talk about this Kawasaki-like disease. How certain are we of the link between it and coronavirus?
I think a lot of people working in the field believe it strongly, although I wouldn't say we've reached scientific certainty at this point. Each bit of evidence that comes out seems to suggest it. We're currently working with scientists from the United States Centers for Disease Control and Prevention, as well as scientists from around the country, to gather a large series of cases to try to understand the extent to which that link exists and to understand more about that illness.
Yeah, I mean, you've been researching it. There's research going into this all around the world, but actually the numbers involved are very small. We're looking at sort of tens of cases in different countries rather than hundreds or thousands. Why is it worth understanding this possible link?
I think there are a number of things to think about. The numbers are small, but at least in the area where I live, in the New York, New Jersey area, they're growing. We're seeing new cases every day. So we don't know the full extent of this. I think it's also important to realize that most of these children, at least from what we know and from our conversations around one another, do not have pre-existing conditions. It points out the importance of social distancing at all ages in the population, including for parents and children.
Now, you mentioned this is possibly affecting children who don't have pre-existing conditions, so that could be anyone's children, really. Should parents watching this be worried?
I think parents watching this should be aware and concerned and focus on the things that they're able to do to protect their children, keeping them away from close contact with others with whom they're not living, wearing masks and being, when you're out, being around people who are wearing masks, washing hands, and keeping surfaces clean, so-called high contact surfaces, doorknobs, counters, things like that, where people touch a lot or where other people may be touching. This is a reason to be concerned. And fortunately, it's not in overwhelming numbers that the respiratory infection went through adults, but we don't know what the future holds. Every day we learn what we didn't know the day before.
And what about national governments? There's a real clamour to get schools reopened in countries where they've been closed. Should there be a rethink on how those are reopened, how playgrounds are reopened, given this new understanding of the disease's effect on children?
I think there needs to be an awareness, and there are many factors that need to be taken into account. In some places, schools are an important source of nutrition for children, so it's a risk to have them closed. That said, we shouldn't do anything hastily. And when we do things, they should be done with the utmost caution and with awareness that children are at risk, and this is not a safe harbor. So I don't think a rush to go willy-nilly is a good thing. What I do think is that it is a sign of strength to delay decisions that can be put off, because the decisions that are made next week or the week following will be made with much better information than the decisions that are made today. Some might see it as weakness or dithering. I see it as strength and awareness of what's happening.
We're constantly learning. Well, Dr Lawrence Kleinman from Rutgers University in New Jersey, thank you very much for your time.
Thank you, Rob. It's indeed my pleasure.
And now it's your chance to ask the questions. Here's our science correspondent, Derek Williams.
Have we finally established how deadly the disease is in terms of the number of infected requiring hospitalization and the death rate?
No, those are things that are going to take much more time to figure out for several key reasons. First and foremost is that in the midst of the crisis, different countries are counting statistics in different ways. There are no global standards. Comparing statistics, even between countries in Europe, is still quite literally comparing apples to oranges, to pears to strawberries. We'll actually have to wait until the pandemic is over to get firm numbers on how deadly the disease really is.
Many vaccines are made with what are called live attenuated viruses. Are there any prospects for an LAV for COVID-19?
Live attenuated vaccines, or LAVs, have been around since the 1950s. They're derived directly from the pathogen itself, which has been weakened in the lab to cause a very mild form of a disease. Now, in general, compared to other types of vaccines, LAVs stimulate a powerful, long-lasting immune response because the immune system of the person who's been inoculated is actually confronted with a disease-causing bug, just in a controlled way, with a damaged version of it. But there's the rub. If you want to create a vaccine directly from a potentially deadly pathogen, you have to be certain that your vaccine is going to be safe and not do more harm than good. The LAVs we use now for diseases like polio or measles have been through many, many years of extensive safety testing. We don't have that kind of time with COVID-19, which is why, according to a list of vaccine candidates published by the WHO, just 3 out of the over 100 candidates in testing at the moment worldwide involve live attenuated viruses.
Is it possible that just like with HIV, we may never find a vaccine?
Back in the mid-1980s, when HIV was identified as the pathogen that causes AIDS, experts predicted we'd have a vaccine for it within a couple of years. But skip forward 3.5 decades, and we're still waiting. Could that happen with COVID-19 too? Possibly. But there are some fundamental differences between the two viruses. A really major one is that SARS-CoV-2 appears to mutate at a much slower rate than HIV. That's good news. It means any vaccine will probably retain its effectiveness against the coronavirus, at least for a while. The bad news is that we've never fully developed vaccines for coronaviruses before. None have ever been approved, but we know from work done on a potential SARS vaccine that making a vaccine that's effective and long-lasting is not going to be easy. Basically, we're in unexplored territory, and we just have to hope that the massive resources and the technology being thrown at these dozens of potential COVID-19 vaccines now in development will bear some fruit.